I'm Richa Kulshrestha. I'm Neuromuscular Consultant based at Robert Jones and Agnes Hunt Orthopedic Hospital, and I'm going to discuss with you about the renal and the bladder complications with advanced stage of Duchenne muscular dystrophy. In Duchenne muscular dystrophy, the renal and the bladder complications are not the direct effect of muscular dystrophy. Instead, they are the secondary effect. The renal complications happen as a result of the cardiac failure and the treatment that is used for the cardiac failure. And the bladder complications happen due to the mechanical effect of the bladder being compressed by the rectum or the forward curvature of the spine. The renal complications, once they happen, they can adversely affect the long-term outcome. And in one of the Japanese studies, 14% mortality has been reported with renal complications like renal failure with Duchenne muscular dystrophy. We do not have any specific guidance about managing these problems, so the consensus statement is obtained from the clinicians who have experience of looking after these conditions, and we have also obtained the guidance from National Institute of Clinical Excellence guidance for cardiac failure. There are certain risk factors that predispose to the renal problems. For example, the heart failure, which happens in late stages of the Duchenne muscular dystrophy. And it is important to start the medications like ACE inhibitors, beta blockers, and diuretics, but unfortunately they have the renal side effects. And it is important that your clinician measures the blood test regularly. The usual recommendation is to measure the blood test for full blood counts, sodium, potassium, urea, and creatinine. Now, creatinine can be low in advanced stages of Duchenne muscular dystrophy because it is dependent on the muscle mass. So it is important to see the trend of creatinine, how it evolves over time. There is another biomarker called cystatin C. It is important to measure that because it is not dependent on the muscle mass, and it will give you an accurate information about the renal function. For certain advanced bladder problems, investigations like urodynamic studies may also be necessary. Even though there is no specific management, adequate monitoring will help to prevent these complications. There is use of neostrine strap, which can help to adjust the spine for exaggerated lumbar lordosis or the forward curvature, and using that can help to reduce the pressure on the bladder. And there are certain medications which can also help with the problems of frequency and urgency of bladder problems. To summarize, one should remember that the renal and the bladder complications can be prevented. It is important to have the annual blood tests for full blood counts, electrolytes, cystatin C, and also ensure that you drink plenty of water in order to maintain good renal health. Thanks for listening.